Hi, Christine.
Hi, Anoop. How are you?
I'm good. How about you?
Good. Happy World Sight Day.
Happy World Sight Day, Christine.
It's nice to see you. It's been a while since I've got to connect with you, so I'm really happy we get to chat this morning.
Yeah, pleasure is all mine.
Well, thanks so much for joining us today. I guess we'll just get right into it. So, can you
Okay.
tell me a little bit about yourself and your role at Operation Eyesight?
So, my name is Anup Zimba, and I'm the country manager here at Operation Eyesight. I look after the South Asia programs, namely India, Nepal, and Bangladesh, and also covering Sri Lanka and Maldives. We are a small team based in Hyderabad.
You've got a big breadth of countries that you work in. Kind of all over the
Yes,
place. Probably limited travel right now for you.
yes. Otherwise, we are on a move continuously every month.
Yeah. So the theme this year for World Sight Day is Hope in Sight. So can you tell me what that means to you?
Hope insight for me is restoring, hope and dignity for the sight deprived people and disadvantaged people across the globe. So that's what all it means to me. Yeah.
I love it. What's the biggest challenge that you face in providing eye care, quality eye care, in the areas that you work?
I would rather say two biggest challenges that we face in a day-to-day basis. One is lack of awareness, and the other one is accessibility to quality eye care. In a country like ours, you can find a bottle of Coke in the remotest part of the village in less than $1. But unfortunately, you will not find basic primary eye care in that village. And for that, a patient has to travel quite a long distance, covering good amount of money and his time in order to get quality eye care. These are the two big challenges that we face in a day to day while we work in the field and with our partner hospitals across India and definitely other countries too. The neighboring countries too has the similar problem. Yeah.
Yeah, I can imagine accessibility being a huge issue. Now, something I'm really excited about that you might have your hands in a little bit and might kind of be a solution for some of this accessibility is the mobile eye unit in Nepal. So, can you tell me a little
Yes.
bit about this and what it means for the community?
Yes. So we have launched the mobile eye unit with Nepal Eye Hospital in Kathmandu. Basically, this van is used for primary screening programs in rural parts of Nepal. This van is equipped with all the primary eye care equipments that is being used to screen people for cataract and other eye diseases. And the van will go to the remotest part of the Nepal in the interiors part of the villages. And then with the help of the medical team, will screen these people, the underprivileged people, and then also at the same time, the best part is bring the patients along with it, right? The patient comes to the hospital, so there's a free transport availability for the patients, and the patient gets operated. The next day, the patient gets discharged, and the van will, go back and uh, and let the patients, drop at the doorstep of their respective communities. So the best part is it's basically, if I could term it in a single phrase or a word, I would say vision on wheels is what we have named it. Yeah.
Amazing. And has that project launched already? Where are we at with the mobile eye unit? And is it seeing patients or are we still?
Yes. So we have recently launched this vehicle on World Sight Day. That is today, and from tomorrow the vehicle is on move, and we will be covering four suburbs of Kathmandu Valley, and going beyond that, around 3 to 4 districts of Kathmandu nearby Kathmandu. So we are very excited. The partners is very excited to to launch the vehicle and reach to the communities. Yeah.
Amazing. I really do love that vision on wheels. And hopefully it counters some of those barriers to access that we're facing right now.
Oh
Um,
yes, yes,
and you've got lots of other plans for World Sight Day in the countries where
yes.
you work. Can you tell me a little bit about that and what's happening?
Okay, so we are launching 13 vision centers across 4 states in India, and these are supported by some of our generous donors, some of our corporate donors also. The partners are very excited, and the Vision Center will definitely reach out to a population of 50,000 each by each Vision Center, and each Vision Center is manned by two female community health workers from the community, and we are very excited about it because when we talk about lack of accessibility, so Vision Center is the solution, is the other solution apart from mobile eye unit that will reach to the community and make an impact to their lives. We also have inaugurated the operation theater of one of our partner hospital, Maharashtra. So having a full modernized operation theater will definitely uh, improve the quality of outcome of surgeries that the patients, will have. We are very excited about this as well. Yeah.
Amazing work. You guys have so much on the go, and it's been kind of a crazy time with everything in the pandemic. And we've really been able to kind of, I
Yes.
know you guys are still in a bit of a lockdown, so it's going to be exciting to kind of get back out there and do some of those inaugurations and be back into our communities. So good work
Yes.
to all the team in India. You guys have been doing an amazing job during this crazy time.
Thank you so much.
Um, what do you wish people knew about the importance of eye health?
The only thing that people should understand is that 80% of eye problems are avoidable or they are treatable, and that is the most important part. Once people know that eye problem can be avoided and can be treated at the right time, then there's no, and the blindness burden gets reduced automatically. I think that's the message that I would like to share to the people, that it's treatable form of, it's treatable and avoidable, and it's only the matter of you being very have that knowledge and awareness about different eye problems. That's all it's required.
Yeah, and I think just making it a priority, right? Making eye health top of mind for everyone and making it
Oh yes.
accessible and
Yes, 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 yes. So if you see, a lot of people do not prioritize eye care as part of their healthcare system or their healthcare behavior. Our priority or our focus of the project is always to improve the eye health seeking behavior in the community, whether it's individual or in a community basis. And once that priority sets in as a part of a daily lives of the patient, then automatically the health behavior gets changed and people are going to access the eye care. And definitely people do not go into blindness. They can avoid it and, by treatment. Yeah.
you have worked for how long have you been with Operation Eyesight now?
It's 6 years now for me.
6 years. So you've been with us for some time. I'm sure you've
Yes.
met a lot of the different people we serve and been into a lot of the different communities. Can you tell us, or is there one story that really sticks out to you from your work at Operation Eyesight that's really inspired you?
Oh, I have 100 stories to tell, but let me pick one of those. It's always, it gives me a goosebump, whenever I recall those incident or that particular event. So I would narrate a recent one. In fact, last year when I traveled to Jammu and Kashmir, I met, we have a project there and it's a beautiful location. Definitely, it's very treacherous mountains out there. So I happened to visit to go to a field with one of our coordinator, and the patient house was on the hilltop. I could not see that house down from the road, and literally I had to take a walk, which took me around more than 1 hour to reach that hill point, right? And I had to take breaks in between. The most challenging part was reaching that house because there was no road. It was all muddy, road with bricks or stones and pebbles and rocks, those kind of stuff. So finally, I managed to reach that house. And at a first glance, I saw a small house with cattle in it at the side. Then I saw a couple, an elderly couple, the son. So they were looked after by a son, by an elderly son. And then when I inquired about, how did we impact them or what was the benefit of the project, the gentleman told me a story that he's actually, when I observed, his left leg was amputated because of some infection and he could not travel, which means basically going up and down the hill becomes impossible for that man alone. So it was our health worker who reached that house, counseled, identified the patient, or the patient had cataract in both eyes, and they were very mature cataracts. And let me tell you, another 1 year more, he would have, just died of, simple blindness, as simple as that. But fortunately, the health worker identified the patient at the right time. The patient was counseled. The next challenge was how to bring that patient from that particular top down to the road. So the son of the house, he carried his father on his back, and he, came down to the road where the vehicle was there, which was the hospital, and that's how the patient was operated. And I was literally taken aback, and I could realize that if we were not there, then there was no one at the doorstep, and that's how we are making an impact. We do not just simply say that okay, cataract is just not only a number, right? For Operation Eyesight, 1,000, 10,000 just numbers. They are people, they are lives that we have impacted. The lives that we have touched because of our intervention. If Operation Eyesight, if the donors were not there to help us, we would not have reached to that particular gentleman's house, and he would have died simple as that, after 1 or 2 years. And that's how, that's the kind of story I would like to tell to the people. That's how we are making an impact. That's how Operation Eyesight is really transforming lives at the field level. It's not only papers; it's really on the ground. Yeah. So that's the story that I would like to narrate. Yeah.
Wow, Anoop, thank you so much for
Mm.
sharing that. I have a picture in my mind of the son carrying his dad down that hill. Like you
Yes.
described it so perfectly. The access for those people is so limited, right? And
Yes.
I'm always really inspired to hear stories of our community health workers because they do some amazing work and they're the ones who are reaching these people and building that trust. And I'm always, like I said, just really inspired by community health workers. So any story I get about them and their impact always really warms my heart. And you brought it back all together, right?
Mm.
That those are the stories we need to be telling. And I'm so grateful to be able to talk to people like you, Anoop, who are in the field and get to experience this, and you can kind of relay those stories back to us. So thank you so much for sharing. Those are so powerful, and I could sit
Thanks,
here and
boss.
listen to you tell stories all day.
Wish I could. Yes.
Yeah. Well,
Yeah.
thank you so much for joining me today. I'm really looking forward to hearing all about the activities that you guys were able to accomplish throughout the day. And happy World Sight Day. Please tell the rest of the India team that we're thinking of them and wish them all a happy World Sight Day from us here in head office in Canada.
Sure. Happy World Sight Day to you and to the whole global office team. Take
Thanks so
care.
much, Anoop. You have a great day. We'll talk to you soon.
You too. You too.
Okay,
Goodbye.
bye.